Vital signs options in Welford chart notes. Vital signs options let you control the performance of the vital signs form. To activate these, click the Vital Signs Options button. You can decide whether to include the temperature on the form and what the default units should be. You can decide whether to include the location of the body where the temperature was recorded, and whether to show the temperature in the alternate units between Celsius and Fahrenheit, or to only show it in the units in which you recorded it. You can also choose which location of the body is checked by default. For the pulse, you can decide whether to include it at all. If you do, you can specify whether there is a default description or whether that is blank, whether you want the position of the body recorded in the writer, whether you want the description included, and whether you only want to see sitting blood pressures on the form because that's the only kind that you take. For blood pressure, you can decide whether to include it at all, and if so, which elements of the blood pressure to record, such as the body position, the limb, and the cuff size, etc. You can specify the maximum number of blood pressure lines that you want to appear on the form, and whether you want the blood pressure to default to the last blood pressure for this patient as stored in the lab book. Check sitting only if you only record blood pressures in the sitting position. This then simplifies the appearance of the form. Check whether you wish to include smoking on the vital signs form, and whether you wish the answer that appears there to default to the last answer you filled in for this patient previously. You can choose whether to include pain on the form, whether to include the comment field, and whether to include the chief complaint. Check separate lines if you would like each vital sign listed in the writer on a different line. Uncheck this if you would like it to appear as a single paragraph. You can choose whether to include respirations on the form, and if so, whether to include a description and the default description for respirations. You can choose whether to include height on the form, and if so, what the default units should be, whether you want the units played back in their alternate mode, converting centimeters to inches or back again, and whether you want the program to default to the last height as stored in the lab book for this patient. You can choose whether to include weight on the form, what units you wish to use as the default for the weight, whether you wish to show the alternate units converting pounds to kilograms or the other way, whether you wish to see the patient's BMI, whether you wish to see whether the patient is overweight or not, and whether the weight is filled in with the last weight as recorded for this patient in the lab book by default. For head circumference, you can choose whether to include it at all, if so, what units to show it in, whether you want the alternate units shown as well, and whether you want the program to default to the patient's most recent head circumference as stored in the lab book. For waist circumference, you can decide whether to include it at all, if so, what units to use, whether you wish to show the alternate units as well, and whether it defaults to the patient's most recent waist circumference as stored in the lab book. So here we're going to simplify the vital signs form by only showing sitting pulse and sitting blood pressure, and thus only 2 blood pressure readings. Press OK to store these settings, and you can see that the vital signs form has been simplified. And that's how to use vital signs form options in Welford chart notes. For more information, visit us at emirj.com.